It was Diane's second trip to the emergency room in 4 months. Again, readings from her heart monitor and EKG were normal. All her blood work also came back normal. Then the doctor said the 5 words that made everything worse for her. It's just anxiety. Go home. She was exasperated because she knew there was something wrong with her, but her investigations and blood reports showed nothing. So how does anxiety create real physical symptoms? Why is health anxiety not an official diagnosis? And how can you tell when it's just anxiety versus a true physical problem? I'm Dr. Eric, quadruple board-certified psychiatrist. I've treated thousands of people struggling with anxiety. And before we go any further, I need you to hear this. You're not going crazy, you're not weak. If you've had the test, gotten the reassurance, and your brain still whispers, but what if they missed something? That is not a character flaw. That is a nervous system doing exactly what it was designed to do, just doing it too well. By the end of this video, you'll understand why. Let's go back to Diane, 51 years old. She's a busy executive who runs a team at work, takes care of her family at home, and her aging mother who lives in another town. Her chest tightness started 5 months ago. EKG normal, blood work normal, but the tightness kept coming back. So when her heart started pounding at 2 a.m., she went back to the ER, where she was told to go home as it was just anxiety. Now, anxiety is not just in your head, it's a full body event. When the amygdala, your brain's alarm center, decides you might be in danger, it fires a real physical cascade. Adrenaline floods your bloodstream, your heart speeds up, the muscles in your chest wall tighten, digestion slows down, your breathing turns fast and shallow, and that alone can cause chest pain, tingling, and dizziness. These changes are real and measurable. Up to 25% of people who come to the ER with chest pain turn out to have panic attacks, not heart disease. The pain was real, the source was different. So, it's just anxiety is the wrong sentence. The honest sentence is, your body fired a real alarm. Now let's figure out why it keeps firing. Here's where it gets interesting. You see the term health anxiety everywhere, but it is not a formal diagnosis. You will not find it in the DSM-5, the manual psychiatrists actually use. The old word was hypochondriasis. In 2013, psychiatry dropped this term. It was replaced by 2 real diagnoses, and the difference matters. The first is somatic symptom disorder. Real physical symptoms like chest tightness, pain, or fatigue, plus worry about them that takes over your life. About 75% of people who once would have been called hypochondriacs belong to this group. Diane did too. Her symptoms were real. So was her fear. The second is illness anxiety disorder. Here, the symptoms are mild or even absent, but the fear of having a serious disease becomes consuming. Constant body checking, endless Googling, appointment after appointment. Or the opposite, avoiding doctors completely, terrified of what they might find. That's the other 25%. Same fear, 2 different patterns. Knowing which one changes the treatment, and it proves something important. Psychiatry itself agrees your suffering is real. Now, this is the part that surprises my patients the most. Your brain has a built-in body scanner. Scientists call it interoception, and it runs through a region called the insula. Its job is to quietly monitor your heartbeat, your breathing, your gut, below the level of awareness. Brain imaging studies show that in people with illness anxiety, the scanner is wired differently. The volume is turned all the way up. Ordinary body noise, a skip beat, a twinge, a gurgle gets flagged as danger. You're not imagining sensations. You're noticing sensations other people never feel. It's like a smoke detector that goes off every time you use your kitchen toaster. The detector works. It just cannot tell toast from fire. Then we pour gasoline on it, we Google, or in this day and age, ChatGPT or Claude. Microsoft researchers track the health searches of hundreds of thousands of people. Roughly 1 in 3 who looked up a simple symptom escalated into researching rare deadly diseases. Search headache and the web serves you brain tumor, about as often as caffeine withdrawal, even though brain tumors strike about 1 in 10,000 people a year. Your amygdala cannot tell the difference between reading about a disease and facing one. Every search, fires the alarm. The alarm creates more symptoms. The symptoms send you back to the search bar. When Diane looked through her phone history, she had 47 heart-related searches in a single week. That is the loop. That loop, an alarm system stuck on high, is exactly what I help people retrain in my program, the Nervous System Reset. The link is in the description below. But here's what nobody tells anxious patients. Sometimes it truly is not anxiety. Sometimes anxiety is the first symptom of a medical problem. Take your thyroid. When it becomes overactive, it floods your body with hormones that cause anxiety-like symptoms: racing heart, sweating, trembling, insomnia. Studies show 30 to 40% of people with an overactive thyroid walk in complaining of anxiety. I've seen patients spend years in therapy for anxiety that was actually due to problems with this gland in their necks. And thyroid is just one. Anemia, blood sugar swings, heart rhythm problems, sleep apnea, certain medications, too much caffeine. And in midlife, hormone shifts may amplify all of it. For many women, perimenopause brings anxiety that seems to come from nowhere. For many men, falling testosterone levels and rising stress load do the same. This is why in my practice, new anxiety patients get lab work, a thyroid panel, a blood count, blood sugar, vitamin levels, micronutrient testing. A psychiatrist who never looks at your body may only be seeing half the picture. It is important to get a proper checkup. Then comes the hard part. Trust the result. Because here's the trap. Reassurance works like a drug. A normal test result feels wonderful for about 3 days. Then the doubt creeps back and you need another scan, another opinion, a bigger dose. Retesting does not treat health anxiety, it feeds it. So what actually treats it? In 2014, The Lancet published the CHAMP trial. 444 patients with severe health anxiety, a short course of cognitive behavioral therapy aimed at health fears beat standard medical care, and the benefit was still measurable 5 and even 8 years later. Very few treatments in psychiatry can make that claim. The nervous system work matters too. Protect your sleep because a sleep-deprived amygdala can worsen your anxiety. Get morning sunlight. Practice slow, deep breathing to activate the vagus nerve, your body's built-in brake system. Cut back on excessive caffeine that mimics the very symptoms you fear. Now, for some of you, therapy and lifestyle changes will not be enough on their own, and medication will be part of the answer. That is not a failure. That is a tool. 6 months after that second ER visit, Diane said something different. The tests never fixed me. Understanding and using a root cause approach did. Her chest tightness did not vanish overnight, but once she knew it was her alarm system and not her heart, once she had a real name and a real plan, the fear lost its grip. You're someone with a finely tuned alarm system that has protected you a little too well, for a little too long. And an alarm system that learned to turn on can learn to turn off. But there is one time of day when this alarm does the most damage for many people, the middle of the night. So if your anxiety spikes when you should be asleep, the next video will help clarify things.